Good evening, everybody. I think there are some people here who are regulars, so welcome back. Some people who are new, I can see some names that I haven't seen before and some faces I haven't seen before. So I'm not going to go around and ask everybody to say their names. If you want to say who you are and where you're from, you could put it in the chat, but it'll take me the whole of the hour to go around this this group, I think. So I just introduced myself and Lynn. So I'm Ali Foster. I'm the Programme Director for Building Berkshire Together, which is the Royal Berks hospital name for the hospital redevelopment programme. And I've been working here for on this programme for 2.5 years, but have come with a long 30-year history in the NHS of doing similar things. And I have a clinical background, not a building stuff background, but I have done a range of different things to help me on this project. And Lynn is our head of comms and engagement, and she is controlling people coming in and watching the comments for me in the background. And she'll talk a little bit later on about some of the public engagement things that we've got lined up that are just around the corner. So what I tend to do is just give a very sort of couple of minutes background on how we've got here, and then talk about what are the things that we're working on at the moment and what are the things in the immediate future and some of the complex issues that are facing us on the new hospital programme. So the first thing is we were put on the new hospital programme in 2019, and the new hospital programme is about a new way of building hospitals. So instead of everybody building their own hospitals and having clinicians and huge teams working on individual designs, the designs will be standardized, and the process of building hospitals will be industrialized, so using modern methods of construction. So that will be building wards and rooms in factories and shipping them in, which is the plan for how we'll build new hospitals. And there's loads of work going on across the country, and has been over the last couple of years, around what does a good room look like, what does good wards look like, and using clinicians, using patients, using the best practice from this country and from around the world to make those standardized designs. So it's taken quite a while to pull all of that together. Equally, the new hospital programme has had to, even though the programme started in 2019, still had to make a business case to Treasury last year for the money to deliver these hospitals. And they only got awarded that money in May this year. Not this year, I'm in 2024 now, May 23. So the money was allocated, and this is for the 2025 to 2030, what they call comprehensive spending review. So that's the money to deliver the hospitals. But you may remember that some of them, there was 5 additional hospitals were added to the programme. They were RAC hospitals, so they've got crumbling concrete basically, and they're prioritised. So they've been told they've got to have whole new hospitals, and so they have been prioritised in terms of when they'll be built. So that's done some things to the hospitals that can be delivered in this round, 2025 to 2030, and some that may have to be built or start construction post 2031. That's April 2031. That will be the next round. So this is all very complicated, but it will come to a point. So there's a lot of work been going on nationally to try and secure the money and do all the standardized design. And then locally, we've been working on understanding what hospital we need for our population. We produced I've done a little slide here that I might talk to now, actually. Share screen. Oh, disabled share. Host, enable me.
Enable. How do I do that? Let's see. It keeps jumping around.
Do I need to take the host back? Shall I reclaim the host?
Yeah, I think I'm going to have to. I can't see how else to do it.
Okay.
Yeah.
Can you see that diagram? Looks a bit messy now, but I'll talk people through it. So I did a bit of colour coding. So NHP is New Hospital Programme. So those are the things that the New Hospital have been kind of doing at that national level. And then the blue boxes are key things we've been doing. We've been doing loads more than this, but they're key to where we are now. So key boxes there are, in 2020, we submitted our strategic outline case, which set out the reasons for why we needed a new hospital. And we've been waiting really for the new hospital programme to approve that. But meanwhile, they've been developing the programme at that national level, and they've been developing a standard way of producing these business cases, which they've issued some guidance now in 2023, December 23. And so we will have to resubmit our strategic case with others towards the end of next year. And there's quite a bit of work to do to submit that strategic case. So in our strategic case, when we submitted it in 2020, we had 3 options to take forward. 2 of them were to redevelop on the current site, and it was a big 10-year programme, and we were asking for the funding for the early phases of that redevelopment. And those funds were between 750 million and 995 million for the early phases of a non-site redevelopment. And we also put in an option for an off-site development, a brand new hospital on a brand new site. And that was estimated to be 1.3 billion. All of those costs to build the same hospital now have slightly increased, but we've also got additional guidance now for anything that we build is approximately a third bigger to deliver the same services. It's almost a third bigger because of the new requirements from the new hospital programme in terms of design. So those again will increase those costs. But we've also been working, because at the time when we submitted it, the board were not 100% sort of landed on what they call a preferred way forward, which it was either a hospital redevelopment on the site or a brand new hospital on a brand new site. So we've been doing some work on identifying a preferred way forward. That's not a preferred option, because there's lots of work to do to get to a preferred option, which involves, public consultations and lots more evidence gathering and due diligence on different sites. So the preferred way forward followed a public engagement exercise, but also we've been doing quite a lot of work on the current site and how that's our site, how suitable it is to build 2.0 designs on the site. So we've been looking at that and some of the geotech surveys, so the underground structures of the site. So at the moment, the trust preferred way forward is a new hospital on a new site. And we are looking at alternative site options to move the hospital to. And we still need to, when we found hospitals to compare with our current site, we have to still compare it and see that it is better than staying where we are. So we've done some site searches. I've spoken at councils on this, and there is a long list of site options. I'll just come out of this for a second because I can't see anybody, and it's a little bit annoying. So we've done a couple of sites. We've identified a long list, and there are a couple of sites that come up and score according to our criteria, score highest. And we are exploring those using due diligence to see if they would be suitable to build a hospital on. So that's where we are at the moment. And then I'll just come back to the funding. Everyone always asks about funding. So funding isn't agreed yet, and we have a particular situation. So when the funding was announced, you'll remember that actually there was a question that was put to the Secretary of State about the Royal Berkshire Hospital, and it's because it's not really agreed yet what our option is. So whether we're going to stay on our current site or whether we're going to move, and that will be based on the analysis of the current site and the geotechnical surveys that are taking place, and also its ability to deliver this much bigger hospital that's needed on a site that's quite constrained. So you've got conservation area one side and residential the other side, and not much land to play with, and what you call swing space. So just talking about funding. So we had an indicative funding allocation in earlier this year, and all the sites have had to look at whether that's enough to deliver their preferred way forward. At the moment, the indicative funding will only accommodate an on-site a partial redevelopment on the current site, and we would be scheduled for construction in post 2031. But we are gathering evidence and sharing that with New Hospital Programme that may well change that position. So that's where we are at the moment. So we are looking at alternative sites and seeing what value for money and access issues and all the other sort of criteria that we would need to look at. We're assessing those, and we are examining in quite a bit of detail our current site and the requirements for building this new type of hospital on the current site. So it's quite a lot of work. It involves, architects, it involves engineers, it involves cost consultants. So for example, if let's say we decided that we need to move because that delivers best value for our population and it meets our clinical needs, the clinical needs of the population. If that's the right decision, then there's a decision about, well, when should that happen? And if, for example, we are not funded until post 2031, we've got to look at the case to say, well, should we be investing money for the next 10, 12, 13 years on this current site if we know we're moving somewhere else? So there may well be a strong case for that, and a case to say, well, yeah, okay, so we could be pumping millions into a site knowing that we're leaving. Is that really best value for the taxpayers' money? But there may well not be the money there to support us to move before that time. So that's a discussion that we have to have with people at the national level. So there's quite a lot of information gathering still taking place. And one of the things that you'll see on the screen there that we've got planned is to go out and ask you about the criteria that we're using. So we've used a criteria that's benchmarked across the country and that other hospitals have used, looked at what our local population needs may be, and said we need a hospital that's a similar size, has an opportunity for growth in terms of size as the population grows. And we've got a set of criteria that we've reached where we have with our long list, and we've even tweaked that. So our initial sites that we found were in Woking Borough Council area. Well, one's actually less than a mile from where the hospital is, but it's in that Woking Borough Council area. So we went back to and are still working with Reading Borough Council officers to say, is there any land that we could use that we maybe not aware of, or should we look at the criteria to see if there's any flex to see if we can come up with options that are in that Reading Borough Council area or closer to the Reading town area? So we are working with Reading Borough Council officers to see if we've exhausted all options in terms of the criteria. So alongside doing that, we want to go out to the public, and Lynn will talk a little bit about the criteria that we want to go out and ask generally people and key stakeholders, people who have groups that they represent. Have we thought of everything in terms of the criteria that we need to be searching for properties for? for land for. So that's where we're at the moment, as well as doing a few other things. But that's a key discussion point that I'm keen to hear from people today. So if I just hand over to Lynn, who will talk a little bit about what the criteria is and the plans for engaging with you all in the criteria refinement, refresh.
Can you just check no one's in the waiting room, Ali, just while you've been host? I was just double checking there was no one in there. So yes, we're planning to launch this probably, if not by the end of the week, definitely early next week. We've just got a few things to tie up this week, but yeah, we basically want your help to assess the potential sites. So we're looking at the criteria, as Ali said, and I'm just going to run through with you the sorts of criteria that we're looking at, and it is worth noting that actually I'm going to talk to you about the criteria we're going to run past you in a survey, which doesn't suit everybody. So we're going to offer some other engagement opportunities to come along and have a chat with us. And this is sort of the first of these discussions, really. So there will be, separate criteria that relate to commercial and value for money, and things like looking at whether, a site might flood, for example, or if any decontamination is needed. So we're working really closely with the planning departments of Wokingham and Reading in particular, because they're the ones sort of nearest to us at the moment for Royal Berks, about things like planning restrictions and flooding. So we haven't included that in our survey, which will be the public facing survey. So the first question we've got to talk about is the site location. And if you've been to any of these meetings before, you'll know that Ali's talked about that being within a 5-mile radius of where we are, which makes sense for our population. But what we're really sort of testing is actually what's the most important to you? Is it the distance from the current location, or is it how you access the site? So is it, can we access it by car? Is it got good access by foot and by cycle and by public transport? Is it more important to you that actually it's near the key highways? That's what would worry you. So is it near the M4, the A33, the A329? And also we're looking at things like health inequalities and deprivation. So you'll be well aware, I'm sure, that there's a greater incident of ill health in poorer areas and more deprived areas, and they've also got poorer access to transport. So actually we need to be really mindful about where we're positioning the hospital to ensure that we are providing the best possible care for those patients as well. So that's another key part of sort of where the hospital will be sited. So what will happen is you'll receive the survey, which I hope you'll fill out, or you'll come and chat to us and give us your feedback, and you'll be asked to say, well, actually, what's the most important thing to you, and what criteria are we missing when we're looking at the location of our hospital? So there'll be an opportunity for you to input into that as well. The second part of the criteria that we're testing with you guys is the planning and the restrictions. And this is all about things like, do you think it's more important that we find a site that we can expand to, or we can expand very close to the new site? Is it important that we look at things like local noise and pollution? Is there already an issue maybe in an area or in a site that we might be looking at that has already got significant local noise? Perhaps it's near factory or industrial units, and as importantly, are those industrial units giving out any pollution that we might need to be aware of? And also things like looking at height parameters as well. So as Ali mentioned, we were looking for much larger acreage, but actually for the right site, we could build up further if we didn't quite have the acreage. So again, you'll be asked to say what's most important about those. So that's the kind of key things that we're trying to get out of this survey, and obviously wanting to pick your brains. We've used other criteria that other hospitals around the country have used, but what we need to do is personalize it so that when we're looking at those site options, we can say, actually, that's not right for us because the community has suggested this, the staff have suggested this, and we need to make sure we're ticking those boxes and getting this as good as we can. So in terms of engagement, there will be a survey, but I appreciate not everybody's a big survey fan. It's not a huge one at all. It's a tick box and then a few boxes for you to add in your own thoughts. But we are doing we're doing another online version of this, but actually what we're going to do is invite Andrew Statham to come, and he's our Director of Strategy Improvement and Partnership, and we're doing a bit of a Q&A with him next month's monthly online, so this might come up again. This project will last until mid-March, so we're going to have a sort of good 5-6 week run of this engagement series, this part. We're going to be doing some in-person events, so we'll definitely be having one in Reading, one in Wokingham, and we'll be looking at whether we can push. We'll be definitely having one in West Berkshire as well, and Bracknell. We'll be at the other sites, so we'll be making sure we get out to West Berkshire Community Hospital and out to Bracknell Health Space, and having a bit of a pop-up stand, and I'll be letting you know kind of these dates so you can come and speak to us in person. And then we'll also be holding some stalls at the local places leisure centres. We're looking at whether we might do that, a couple in some supermarkets as well, but I'm just exploring the options for those. So again, if you've got ideas about where we might be missing, then please let us know, or if you've seen other stalls that have been busy, then let me know. So yeah, there'll be lots of opportunities to have your say, whether it's writing an email
Just to
or
add,
seeing us in
just
person.
to add to that, Lynn, that this is about the criteria, and
Yeah.
very quickly we'll be updating that and using that to do another refresh of the site search. And once we've identified a couple of sites that score highly on that criteria, we'll be engaging with you again on what an impact assessment would be on. So once we then have those sites, we'll be saying, okay, as most of you know, one of the sites at the moment that's scoring quite highly is one in Shinfield at the University at the Thames Valley Science Park. So we would have events and discussions and lots of engagement with you to say, right, what would be the impact on you if we did this? And we'd be asking that of staff, of patients, of the people who live there. What would be the impact on them of having a hospital out there? So we have a huge piece of work then to do an impact assessment on any sites that are selected. So we'll be going out and engaging with you again on that.
And that'll be that'll be a bit of a longer process. So this is a bit of a 6-week dip, a dip in to find out what the temperature is for this criteria. And then, as Ali said, it'll be much more involved, and that's expected to start. Well, the preparation starting now, but the actual going out and chatting to you will be happening. Sort of April time. So yeah, this is just the beginning of the next round of engagement, basically. I can see a few questions popping through, so it might be worth us.
Yeah, let's stop and take some questions.
So Helen said, given the long timescales, how can we be certain that a preferred site would still be available?
That's a good question. There is provision. If we go to consultation, so this is what's happening in other sites, there is provision in the new hospital programme to put either some money down towards as a statement of intent. It depends on the owner, of course, but as to what they accept, or to buy land. So that's called using enabling funds. So if we that there may be some risks that we look at whilst doing that. So we might some sites are looking at buying land, and if something happens that it's not right for them, or they go through that process, they then look at selling that land. But it is a big issue because these things can take a lot of time. So there are other areas looking at how do we purchase land sooner, so that we can secure that rather than go through a whole process and then we lose at the other end. So it will depend on the land we have our eyes on, who's the landowner and what arrangements we can negotiate, and what the appetite is for taking the risk to buy the land at the time that we need to buy it.
Okay, next question is from Kate. What local hospital sites have been compared to the Royal Berks? As in, you can probably appreciate that hospitals have specific areas of interest. So I think that's looking at, well, it's a very good point, actually, Kate, about where we're located. We can't go too close to other hospitals. We've got to look at our population. And also some hospitals do have specific areas of interest. So we're working very closely with Bob across the system to make sure that we are getting the right size hospital and that we are providing the right services.
Okay, so those who aren't aware, Bob is the name isn't a friendly name we call our system, but it's Berkshire, Buckinghamshire, and Oxfordshire. Haven't done that in the right order, but you get the drift. That's who we call Bob. So those are the hospitals that are in that whole system. There is what they call an acute provider collaborative across those. So they are now looking at. So we're going to build a new hospital in this system. What are they expecting from us in terms of what we're building? What services are we going to major on? What services might we want to hand to other people to do? Because that's what they major on. So there's some work at the moment to say, what are we specialising in 8 to 10 years' time when doors open? And what is it that other people will specialise in? Equally, we have 2 other hospitals that are being built in close proximity to us. So we have Frimley, who is a RAC hospital, who will be built before any of us. Not that I'm bitter, but they're prioritised because they've got RAC. So they will be going first, and Hampshire are due to go to construction post 2031, and they have a new hospital as well. So we are talking to those hospitals because they're in the same region and not very far away from each other about how we efficiently using all the resource coming into the region into those hospitals. So there's quite a lot of discussions at that level. So it's a good question, and we have to keep an eye on those things that are happening as well.
Tom Lake has said, have we ruled out splitting the hospital between sites? The Thatcham and Bracknell sites have brought services closer to patients.
Well, so it depends what you mean by split site. Our clinical strategy is clear that we want to deliver services closer to where people live. And that means utilising our spoke sites or our satellite sites, so Bracknell and Thatcham and Windsor and Henley, for example, or explore other areas that are closer to where people are. So some of the work that's happening with the local council, for example, in Berkshire West, is exploring what we talk about one public estate. So what are the buildings that the other NHS uses or the council uses that we might want to join in on and work with them on. So there is going to be much more looking at where services can be delivered closer to where people live, and that they don't have to, as you can imagine, there's thousands and thousands of people who come for an outpatient appointment to an acute hospital with all the parking and hassle that's involved in that. And they're not acutely unwell. They're coming to see a specialist, but they're not acutely unwell. And so some of those could be done closer to where people are, and diagnostics, and that's starting to happen now. In terms of a split site, we had in the strategic outline case 3 years ago ruled out a split site, and on the grounds mainly that it wasn't economically viable, using the same staff to move from one site to another and running 2 big sites. With all the movement of services that might go to these other sites, when we update our strategic case, we will look at that again. So we will look at whether that's still an option we wouldn't want to explore, and just make sure that we have covered that off. So it's not completely ruled out. It will be considered while we're doing this strategic case in the next few months.
Claire and Helen have both asked for more engagement in South Oxfordshire, which is great. So thank you for the feedback. I will certainly be asking for Cadra's help. So thank you. That's really helpful. John Wakeford has said access by public transport, cyclists, walking is crucial for patient, staff, etc. So car transport and parking are reduced and impact on climate crisis is minimised. So it was a comment more than a question, but
yeah,
absolutely. John has said, I understand that the Treasury claws back money from trusts for their building costs, typically written down over 60 years. As much of the RBH is circa 17 years old, can we afford to discard it with a consequent penalty on care delivery? We welcome speaking as well, by the way. Everybody's been writing
Yeah,
comments in
so
the chat, but if
who
you
made
want to
that?
talk,
Who made that comment?
that's John M.
John Just trying to find it here. Oh, right. As much of the RBH is continuous, can we afford to discard it with the consequent? The RBH is most of it is older than 17 years. We would have to, and the consequent penalty on care delivery. I don't know. I don't know what that means. Is John in? Is John?
It's John Mitton here. The point is that the more they claw back from you, the greater your building costs, the less your capitation stretches.
Yes, but that's part of the business case, John. So if I give an example, the new hospitals will be all 100% single room occupancy, and that will cost more, obviously. But the business case for that is that people actually have shorter stays in hospitals. They manage to get sleep. They have less infections because so the costs in terms of some of those things get reduced in terms of the care delivery. So the point is you're investing in capital in order to deliver efficiencies and productivity gains, which is what we have to demonstrate in our business case. So that's the intention. Whether it happens, things happen, don't they, around the corner? But in the business case, that is what we have to demonstrate: is that this investment in our capital will deliver efficiencies in our revenue.
Okay. And then John Wilkins is talking about the Public Accounts Committee. So he said, I think that last year Public Accounts Committee criticised the RBH replacement project with regard to staffing and organisation. Have the concerns been addressed? And if not, why not?
The RBH, it criticised the RBH replacement project. I wasn't aware of a specific There
was certainly one report, and I can't remember if it was the PAC, that basically said the project wasn't properly organised. And it was raised at a previous meeting. It may not have been the PAC, but it was one of the government committees.
At the Royal, I think the only comment that I can remember being made was one in Commons about we've been on the new hospital programme and we've not started building yet.
No, it wasn't that. It was specifically concerns about the organisation and staffing of the project. But maybe people have got short memories, so it sounds as if nothing's been done.
Of this project or the new hospital programme?
It was specifically about Reading, as I memory served. It was only last year.
Okay, well, if you can send that to me.
I raised it at one of the previous meetings and didn't get a very satisfactory response.
We haven't had any concerns raised with us about the organisational staffing.
All right. I'll have to see if I can find it. Thank you.
That'd be great. Okay, thanks, John.
I'm not going to spend hours looking.
I think that's the last one on there. Does anyone have any questions they want to raise their hand or anything at all? Kate, is that a hand?
Thanks a lot, Alison. I raised the fact that basically we've got to think about the new site and travelling and spending more time travelling and actually being in the actual hospital sector of either clinic. I mean, I socialised sadly with 3 hospitals in Oxford, most of which need to get 2 trains and 2 buses, namely the Knock as well as the Churchill for both specialist areas. So I don't really want to have to think, oh no, I've got to plan, a couple of hours journey to get to the new site within Reading, coming in from West Berkshire, for those that don't know. So, judging by the railway sector, that obviously try and improve their network as well as the price increase, we don't want to then be out of pocket petrol or public transport finance, because we've had to, pay more to get to the place of site that's going to be built, where it's going to be built eventually. You see what I mean?
So the transport to
The hospital, yeah. I sent Lynn actually an email this afternoon. Actually came from Patient Access, which is, I don't know if many of you know that, is connected up with some GP surgeries. And that was about particularly to GP surgeries and also hospitals. And I thought, right, that's coming out of my inbox and going straight into Lynn's. So that was also quite an eye-opener for me, because I heavily rely on it, like I have to rely on public transport to get anywhere, basically.
Okay. Oh, I thought that was, there's a comment in there about the Bob, that's the Berkshire, Oxfordshire, Buckinghamshire, draft primary care strategy is looking to move to integrated neighbourhood teams with some involvement of acute specialists. A supporting element of the strategy is estates possibly identifying local health hubs. Presumably all that impacts on the new hospital plans. Yeah, absolutely it does. So alongside this work, there is a transformation team working with clinicians across the hospital and in GPs and community team across the local system at transformation projects. And that is to help to move to that model. So looking at same-day emergency access, looking at virtual hospitals, virtual wards, looking at a range of initiatives focused on particularly high areas of need, so people who are frail as well. So there's a project on frailty and people who require extra support. So how do we give that support much more locally rather than coming into the hospital? So there is, Sarah Webster is the lead at what we call at place level. So that's at the integrated. We sit on that board, as does Berkshire Healthcare, which is the Community Mental Health Trust, as does the council. And so they all sit across on that in those groups and look at these transformation projects and how we can shift where care is delivered going forward. And that's a multi-year project, but at the end of it, that should help us to understand what's left that we absolutely need to have in an acute hospital, and it'll help us to right size our hospital. Just seen a comment on a rumours about this, that a site in the science park would need a new M4 junction. Well, we are looking at that. So we have been talking to Wokingham Council and Highways England. There is some, so it is an option we have to explore. I have to say it's probably the least attractive is at the minute is a new junction, but we do have to explore whether we need one. And the way that we do that is we're working with Reading Borough Council and Wokingham Borough Council, travel and transport, local planning leads and officers to do some what they call modelling, as is way above what I know, but they will do some modelling because they're the experts on, if we were to put a hospital in that area, what would it do to the local traffic or the flows, how people might access that hospital and where they might come from and how they might access that. So that work is happening over this next 3-4 months. And from that modelling, it will recommend what changes would need to happen in that area or nearby to enable the hospital to be situated on there. One of the options that is being explored is a new junction, but it is something that I think it's fair to say Highways England have said you need to exhaust all other options before you explore that one. It's hugely costly, quite complicated. But we are exploring it because we have to. What's the next question? By the time we move, Green possibly hopefully reduce the use of cars. Wow, you'd hope, or at least change them to electric cars. It was really interesting. So when we did go up and have a look at the site in Chinfield, we were concerned. One of the concerns was it's near the motorway, and there's this noise, from the cars maybe, or the fumes. But by the time the hospital's gone up, the plan is well, maybe that they'll all be electric and it'll be quieter, but they won't be emitting. And so we do have to think about what will be around when we're opening the hospital. It's not about what's around now. And similarly, it's the digital. The biggest challenge we have is the digital technology that is just going at an exponential rate at the minute in terms of what's available. So I keep using this example because it still astounds me that there are places in America now using camera pills. And we are trialing camera pills in this country, which means that instead of you going for an endoscopy where you need a room and to look down, you'll swallow a pill at home, probably be sent at home. You'll swallow a pill, it'll take all the pictures and beam it up or send it, Wi-Fi it, however, to the doctor in the hospitals. You won't even need to go to hospital to have some of these scans. And yet we're having to build, create designs for hospitals now and think about, do we need those X-ray type rooms? Because in future it might be done in a different way, that sort of thing. So, and AI is also adding to that. So it's really hard to second guess, but we have to think about what will the green policies look like? What will the digital look like? What's our best guess so that we can design and shape the hospital many years in advance of before we have to actually build it. So it's really tricky. No other questions? Everyone's putting their questions in the chat. It's a little bit of
a quiet one
pattern here. Normally that's a quiet one today. It's lots of people on, but very, very quiet.
I think one thing I did omit, is that we'll be doing lots of staff engagement as well. So I just wanted to reassure you that, staff are absolutely top of the list with this engagement, to think about the criterion and the subsequent piece of work, which will be the impact, because we can't run a hospital without them. So super.
And they're the ones there every day. So although as patients, you'll come in for an episode and go again, they're there every day. And it's really important that we attract the best staff, and we will do that if we have really good working environments for them to come to. So it's really important that we don't put a hospital somewhere and then can't recruit the staff to go and work in it.
Absolutely.
Is it right? Is it right that a hospital can't be built within a certain distance? Yes. So the distance of the AWE atomic weapons, is it establishment? Is it? What's AWE? It's
I'm not sure what the
weapons place. If it's the
atomic weapons establishment
exclusion zone has recently been, it's in the last couple of years, been extended from 1 point something miles to 3 miles, and what it's done is it covers quite a bit of green park area in particular. So it doesn't mean you can't build on it. There's restrictions. So for example, you would have to sign up to locking down for 48 hours. Well, we can't sign up to that, and although they say the risk is really low of anything happening, well, the risk was low of COVID happening. Things happen and there's a risk, and if there's a risk, and we have to abide by that. So we can't take that risk and build within the exclusion zone. We can't build a hospital in that exclusion zone. So where previously we had been looking at some land in Green Park area in particular, that's now been excluded because of this new exclusion zone.
Can you hear me?
Oh yeah. Yes.
Hello.
Hello. Can
you hear me?
Yes, I can. Who's that?
I tried asking a question on the chat, but I get the impression from, I'll introduce myself. I'm Chris Giles. I'm a patient. My concern is transport access for all people, and that's staff and patients. And I'm a little concerned that Shinfield is a clogged up area. Obviously, no doubt the RBH where it sits is a clogged up area. And my question's always been, why can't we build up higher? And I posed the question, and guys in London, they built a 20-story new hospital right behind the existing one. So that's been my question for years.
Yeah, so it's a good question, because we've been exploring that with Reading Borough Council in particular and their planning department, and has also fed into adjusting our criteria. So, for example, on our current site, we have asked if we could build up higher, but as I explained, there's a conservation area around one side and residential area around the other. So planning, we think would be quite restricted in terms of building a high structure where the hospital currently is. But what we did do, because we were looking at around 26 acres, we did what we were looking at was with Reading Borough. They said, well, we haven't got that size of land, readily available in Reading. But what about if you had smaller land but could build up because you could get planning somewhere else? So we even looked at having a smaller plot of land with the ability to build higher in Reading. So it's not that we're against a higher structure necessarily. It's just that hasn't been the land, and in where we are, the planning, we would not get planning to go much higher than maternity building at the moment.
That's disappointing.
Yeah. Kate, is that a hand?
Yes, it is a hand. Thanks, Alison. So I think with looking at the ranges of hospitals that I go to, there's always going to be some there's going to be some problem with the port of transportation getting there and actually being able to park there as a whole, whether you're dropping off disabled elderly relative or picking up for that matter. There's always going to be some percentage of patients that are going to be very unsatisfactory with the amount of car parking, and also whether it's on the edge of a risk of a floodplain. We've just had all this flooding. It's been absolutely dire over here in West Berkshire, as you can probably appreciate. So I would therefore think that maybe to look at negotiating with transport companies, such as we've got Reading buses around obviously the RBH area. We've got Thames Travel Back cover up to Oxford, as well as Pangbourne and other areas such as that in the community sector as well as the community volunteer. But I would actually personally think hopefully the amount of hospitals that are built within the Thames Valley actually have enough disabled parking spaces to actually contemplate the fact that there are more disabled people coming into the community, whether they're moving from outside the community into the community or vice versa, or just coming into it visit for the day.
Thanks, Kate. It's a good point. And just to come back slightly to the health, as to the impact assessment we'll be doing. So do you remember for example, Christopher Giles, you just said about Shinfield and having concerns about that. So what we would be doing as part of, if it was Shinfield we were looking at, we would be looking at what is the impact on the population of trying to get there. What is the impact on the village or the area or of building in there? But we don't just have to say what the impact is. We have to look at what would be the mitigation to that. So we would have discussions with, so if it's buses, we would have discussions with Reading and with Wokingham and say, what are the opportunities for increased buses for these particular population groups who now, instead of one bus, it would be 2 buses or 3 buses. Is there an opportunity to extend a particular bus route or other types of access like that? So we would not just come up with what's the impact. If the impact is detrimental to people that currently it isn't, we would need to come up with, well, what are we going to do about it? We can't just say, well, that's hard lines, we'll move to Shinfield.
West Berkshire Community Hospital, in fact, has now implemented a registration plate ticketing system where previously before there were people that were parking up at the hospital, taking up spaces for patients and outpatients, as well as visiting family to inpatients, and then getting a bus straight into town because they believed it was cheaper to park up at the hospital rather than park somewhere in town. when they can walk to work. So that's now thankfully been stopped. And there's such a difference in actually the car parking that I've seen. Although I get buses, I don't drive, but you know, there's such a difference. And I've heard so many people saying it's just actually nice to be able to physically park at a hospital where you're being seen by the medical sector, no matter how long the clinic is or how long, you know, your bloods are that have to be taken. But just being able to physically park there and not have to drive around the countless streets surrounding the hospital is just bliss, to be honest. I've had so many comments about that. It's incredible.
We've done quite a bit with parking. It's still not 100% there, but it has eased quite a bit. We've got a park and ride that we have staff and patients can use. That's down at Thames Valley Park and at Mere Oak, which has been really, really helpful. Also parking for staff at Queen's Road and at Oracle. That's all free. So that's if you park off-site as a member of staff, that's free. And so that's really incentivized quite a lot of staff to park somewhere else to try and free up the spaces that are on the site as it is. And yeah, we've extended the park and ride now to patients. So we're seeing some easing of that, but it's still not enough. There's still times when people come in and they have to go drive round and round, which is just so frustrating. And people get anxious then they're going to miss their appointment. One of the things that we did as well was the parking when you pay. You pay when you leave. So that also helps. That kind of thing is to try and alleviate people's stress about having to try and work out while they're trying to get to their appointment, work out the pay, and so that's to take some of that out as well. So we've done quite a bit of changes, but it's constantly being reviewed, constantly. I'm just looking at these comments. What are the number of staff and patients attending RBH in one day? It's a good question. There was a figure. I'm not going to make it up, but I would, we're talking thousands every day. There's the staff that come. There's the patients who attend. There's the people who work in retail, and there's the deliveries that come. There's people who have meetings that come. There's literally thousands every day that come in and out of the hospital. It's a good question. It is something that they're going to have to be more precise about when we're doing the travel analysis for the different sites. But I don't have the figure to hand. Maybe Lynn, if that's an action we can just take for the next, that would be quite interesting to have a look at. Can I send the program slide? I can email that out. Would prefabricated and assembled operating theatres, labs and recovery beds be ideal for instant assembly on the new site? Very helpful update. Prefabricated and assembled operating theatre. So on a new site, the new way we're going to be building hospitals is that they are going to be built mostly in a factory off-site and then brought in. It's called modern methods of construction. That is how most of the hospital will be built. Not all of it, but most of the hospital will be built going forward. And they are, at the moment, lining up all the suppliers for that. They have been doing the design for that. There's a video. Lynn, did you manage to get that video? We'll hopefully get it for the next.
Yeah, we definitely will.
It's a really, really good video that they've put together that highlights how they're going to do this process of building off-site and bringing it in and what that looks like and where they've got to in terms of the design. So we'll try and bring that for the next session. Many patients December. Claire, the one thing that we would encourage people to do, and I know it's not always easy because you go there and you have an experience and you come away and you go, oh, that was annoying. But then it would be helpful to share that with us. So like, if you don't mind, Lynn might just get some more details from you around that, because it's really helpful for us to know when these things go. But I know myself, I know when I cast my mind back to when I had my baby 13 years ago, and I was you know, and I'll describe this story in detail to loads of different people and tell them, oh, this went wrong and this went wrong, and oh, it was a nightmare. But I never told anyone in the hospital, because I was just so glad to be out of it, that I was so glad to have like got my baby, and I was happy and leaving. But there were so many things that I could have fed back at the time that would have been helpful for the staff to know. And we really do welcome feedback. So even though some of it might not be directly relevant to the new hospital going forward, we will take feedback that comes up here, and we'll feed it back into the hospital, to the patient advice team and patient experience team, because you know, all feedback is welcome. So yeah, Lynn might just reach out to you, Claire, and just get a bit more details on that. Any other questions? Am I missing
you're
any?
up to date from what I can see.
As always, even though you're very quiet tonight, you can email me. You need to chat about something, you can always like email, and we can set up a meeting and have a quick conversation.
We've missed Tom's.
Oh, you've missed some questions. Oh,
sorry, Tom. We did the splitting sites. Oh, I can see it. So, Ali, I've heard older patients complain about the distances walked. So a hospital should be built up in any case, or have travelators. That would be good.
Yeah, I'm all for up, but you know, it's once you get to a certain, I think it's six floors is optimum, then it gets quite complex to build higher. It's not, you know, obviously like Brighton has just built a hospital and it's 11 or 12 stories, because that's the space that they had. But it does make things a lot easier. You get in a lift and you're there in 2 seconds. I know what it's like traveling around the currently in the Royal Berks, and it is a long way. We do have people to help people who need to move around, but it's not ideal. So there are optimum designs for brand new hospitals that we are hopefully going to use when it gets to our turn. Any other questions there? Was that Tom's question, Lynn?
Yes, I couldn't see any others, so correct me if I'm wrong,
Tom.
There's
something there about Caversham. I don't know if I've covered that.
Hello, it's Helen here. I've sent you a private message.
Okay. Alison, with the buggies currently going around the Royal Berks, would it be possible for them to go around the entire site? Because I know that sometimes they can only stop at a certain part of the hospital because of the access.
So where were you thinking, Kate?
Well, I was thinking about, I remember them only saying that you could only go down so far. I think it was where the stroke swimming pool used to be. And they could only go so far. And it would be nice to actually have a buggy map as to where they can go. As opposed to, I mean, obviously going back from what Tom was saying about the older patients complain about the distances walked. I mean, that can be taken into the disabled community as well. Yeah. I mean, I walk around with a paralyzed foot on as well as crutches. But it just makes the patient feel more reassured to actually have a buggy map of how far they can go around the current site, and then have a buggy map to say, look, we can cover everything, all areas.
It's a good idea. I don't think I've seen a buggy map.
I haven't seen a buggy map actually. I mean, I've seen it's coming because I was in the JR in November and I was in the NOC in December, both in Oxford. And it suddenly dawned on me that actually, how on earth? I mean, I know it's introducing more mapping to the service and also the colours on how to, whether one goes one way, like particularly to our unit or another department such as outpatients or whatever. It's a bit like the underground lines, if you want to put it that perspective. But I just think maybe having or creating a buggy map to say actually, and then having the buggies in different colours so that, the red would be such as going out down to outpatients, orthopedics, fracture clinic, whatever is down there. And then the same as to another part of the hospital so that you get the right one.
Okay. That's a good idea. We'll take that back. I think that's
Thank you.
Yeah, thanks, Kate. Right, so it is gone 7 o'clock, and on an evening. I don't want to eat too much into your time, but please, if you've got any other questions, give me a shout, or any comments. I'm also happy to come to groups. I've been out to patient groups, AGMs, so no groups too small. If you want us to come and give an update or come and share what we're doing, we're more than happy to do that as well. And I guess if not, I will see you all next month. Some of you have a nice evening.
Thank you.
When's our next meeting, Alison?
It's February
22nd of February.
Okay.
22nd.
Yeah. Is it 22nd? Oh, goodness me. You've put me on the spot, Kate. Hold on.
Well, it's got to be advanced.
Yes, 22nd. It's at 7 o'clock.
Brilliant.
Okay.
Okay,
Thank
dokie.
you all.
Well,
Thanks
thank
all.
you. Thanks.
Bye.
Bye-bye.
Bye.
Thank you.